also the partners here as well. And as of yesterday, for those who are in Geneva, we had the Jet d'eau turning blue to commemorate that. And what a better way to end this week than having an intergenerational dialogue. Today, the dialogue has a format that my colleague is going to present is really kind of different format, but the idea is to have professionals from all sectors, all regions, and all age groups to bring a really dynamic conversation on what are the major challenges and opportunities in terms of antimicrobial resistant policies. Before I pass the floor to the first speaker, I would like to acknowledge the work of my HDA team and also the GEN team, and especially to my colleague, Dr. Abhishek Bhatia, who most of you have been in contact with, and who is the chair of the Health Diplomacy Youth Network, who could not be here today because of a passing of a familiar today in India. So our sympathy for him and his family. And to start, I would like to pass the screen to the working group liaison of the Health Diplomacy Youth Network. And he is a pharmacist working in National Institute of Health in Philippines and health promotion programs. And he's going to be sharing the outcomes and key messages from the pre-event survey that he was conducted. So I will pass the screen to Bill Wilson, who is joining us from Philippines. Over to you, Bill.
Thank you so much, Catherine. If we could have the slide for the survey, please. Next slide. Thank you so much. Excellence and colleagues, good evening from the Philippines. So as Catherine mentioned, before we start the dialogue, I'm honored to share the results of a survey disseminated by the Health Diplomacy Youth Network over the past couple of weeks. We identified the perspectives of youth on AMR and their inclusion in tackling this truly intergenerational issue. So through the survey, we hope to co-create the future AMR initiatives, paying special attention to the perspectives of youth and how we can support and strengthen their various possible roles. So as you can see on the slide, this survey revealed several clear insights among young people across the different regions from Asia, Europe, North America, South America, and the Middle East. First, the common barriers they observed in communities include low awareness about AMR, weak water, sanitation, hygiene systems, and the continued inappropriate use of antimicrobials. These challenges were seen consistently across countries, regardless of the region. And when looking at what young people expect from governments and international organizations, three priorities emerge very, very clearly: strengthening education and awareness efforts, improving AMR surveillance and data sharing, and regulating antibiotic use more effectively, especially in agriculture and livestock. Next slide, please. And a very strong highlight from the survey that we want to particularly emphasize is that young people feel more meaningfully included in global AMR initiatives than at either the national or regional level of AMR activities and initiatives. However, we see that in all areas, young people clearly want to be part of the solution. The range of activities they are interested in includes research, awareness campaigns, international negotiations, and digital advocacy, which shows their strong willingness to contribute to the global fight for AMR. This highlights significant potential for young people's inclusion in such activities. And together, these trends highlight a motivated and engaged youth population, one that is eager to contribute and will benefit from more structured and consistent opportunities to meaningfully influence AMR policies and strategies. So we hope this could be discussed further in the intergenerational dialogue, and I thank you very much.
Thank you very much, Bill. Before we go and dive into the dialogue, I would like to now invite our next speaker for a keynote. And our next speaker is His Excellency Ambassador Fernando Lublis, who is the Ambassador of the Oriental Republic of Uruguay and with a distinguished career in international relations, particularly in multilateral. negotiations and forums on environmental, human rights, trade, and regional integration. And he's also a member of the Global Leaders Group on Antimicrobial Resistance. Ambassador Lucas, I will before I will pose you some questions before you can speak. So we would like to know how is the position of Uruguay in terms of advancing national action plans on AMR throughout its priorities, partnerships, and the inclusion of leaderships of youth people. Over to you.
Thank you very much for the question, and I'm delighted to join this very important dialogue on AMR. In Uruguay, we are celebrating this week because we think that giving public awareness of this very important issue has to be a celebration. We have united all the different organizations, ministries, NGOs that are working in this very delicate issue in order to project the efforts that internally we're doing, and also the very important support that the international community is giving us in order to mobilize more resources in order to combat this issue. Excellencies, colleagues, and young leaders, I'm delighted to be with you from Montevideo, Uruguay, a city that has several buildings lighted with a blue, joining our global campaign this week. Antimicrobial resistance is one of the most pressing global health and developmental challenges. It threatens our availability to treat infections, safeguard food security, and sustain economic growth. The political declaration adopted at the General Assembly high-level meeting on AMR represents a significant global commitment, but now is the time to turn the commitment into concrete action, and this is what Uruguay is doing. Uruguay has taken decisive steps. Our National Action Plan on AMR, launched in 2018, is grounded in One Health approach. We are strengthening surveillance through GLASS and RELABRA, improving infection prevention and control in health facilities, and promoting rational antimicrobial use in human and veterinary medicine. We're also investing in vaccination and WASH to reduce infection risks. Partnerships are central to our progress. We work across ministries, health, agriculture, environment, with the academia, with the University of the Republic, with our research institutions, not only on health, but especially on animal health, since we are a country that basically export a lot of food to the world. We are seeing a lot of collaboration between the different ministries, academia, and regional networks from this region, Latin America and the Caribbean. Uruguay also engages with WHO and the quadripartite for technical support and monitoring. Importantly, we are empowering youth. AMR education is integrated into school and university curricula already in Uruguay, and young professionals are leading advocacy and research through regional platforms. Their leadership is absolutely vital for sustainability. Globally, we must accelerate implementation of national action plans, ensure sustainable financing that is crucial for the implementation of the different measures that we want in place, as the sooner the better. And also, we are committed to strengthen the governance on this issue. We need to scale up infection prevention, equitable access to antimicrobials and diagnostics, and invest in innovation. And we must end youth participation in policy design and monitoring. The theme of World AMR Awareness Week 2025, Act Now, Protect Our Present, Secure Our Future, is a call to action. And I am very glad to tell you that all ministries, universities, research centers have joined the campaign in order to give visibility to this year's campaign through their networks, organizing different events throughout the country, and also illuminating the most emblematic buildings of the capital city, Montevideo. Acting now means investing in prevention and stewardship today, so future generations inherit a world where infections remain treatable. As a member of the Global Leaders Group on AMR, I will continue to advocate for stronger political commitment, mobilize resources, and champion inclusive governance that brings youth to the decision-making table. Together, we can turn commitments into action and protect health for all. Thank you very much for having me, and I will continue to work actively with this group. Thanks.
Glad to hear about the national plan of Uruguay that includes education in school and university and the integration of youth, also in policy design and monitoring, and as well as the position of bringing youth into the work of the global leaders on AMR. Thank you very much. Up next, I think this is a quite excited moment right now where my colleague, she will be leading the intergenerational dialogue and she will explain you about the format, which is a different format. So over to you, Jasmine.
Thank you very much, Catherine, and thank you for giving me the floor. So it's a pleasure to open today's dialogue. And before we begin, just to explain briefly our format, it will follow a dynamic structure, which each speaker will introduce the next one and ask them the question. So I have the pleasure to introduce Ms. Jacqueline Alvarez. She's Chief of Branch Industry and Economy Division at the United Nations Environment Program, and her expertise spans over 25 years of professional roles in political management and technical capacities. So Ms. Jacqueline Alvarez, allow me to open the discussion with a question for you. In the context of triple planetary crisis, what are key actions are needed to address antimicrobial resistance?
Thank you very much, Yasmin, and it's a pleasure to be with all of you here today. And to answer that question, I might start with a little story. This is a story of the visible and the invisible. Those of you that have worked in certain areas always know that you know some things, but you don't know other things. But the don't know doesn't mean you cannot act. What it means is that you need to be more careful so that things can work and happen. So AMR, if you just stop anyone in the street and you ask what's AMR, they will just say, oh, my dog had an infection that I couldn't deal with an antibiotic, or my father has passed through surgery and it was very difficult. But I, in a way, challenge you to tell me if you have found one person telling you the environmental dimensions of AMR, or why environment matters to the AMR agenda, or the other way around, why AMR is part of that context and environment that we have. So you were asking about the triple planetary crisis. For those of you that also follow UNEP's agenda, we have defined several years ago that there are three main big challenges the world is facing. One is the climate challenge, the other one is the biodiversity loss, and the third pillar is the pollution pillar. So to really answer that question, we prepared a report way back in 2023. It looks like yesterday, but actually it's 2 years ago. And it was launched by Mia Mottley, the Prime Minister of Barbados, in one of the Global Leaders Group meeting. Very proud we are about that because it's bringing many different topics. So for example, if we look at climate, right? When you see what are the consequences of the changes that our Earth is having because of that, what we can see is that higher temperatures are associated with diseases. Diseases are associated with AMR. for example. But it's not only that. Extreme weather also contributes to spread of antimicrobial genes somewhere in the environment. And that also, maybe if I tried to talk up with the jargon of climate, we know about methane and we know about the cycles of carbon very well, right? So those cycles are also, or can be also impacted on antimicrobial resistance. So we live in a system, we cannot detach from that system. And why I was talking about the visible and the invisible, because those things tend to be invisible to all of us. And then when we look at our biodiversity, our second pillar, that's where we see that the soil's health is also related to the presence of microbes. What do they do? Of course, they survive, as we are trying to do. So they change, they mutate, and that brings that if you don't have a very good sewage system, or if you don't have a good municipal solid waste landfill system, or you are in a way not dealing with your waste in a good manner, and I'm starting to talk also about the pollution side, those things are drivers of antimicrobial resistance, but not only that, it's also the spread that happens, and we cannot see those things. So misuse of antimicrobials is one of the biggest maybe things that everybody knows. We have to be very careful about how to use them. But there are other things as well. For example, heavy metals, lead, mercury. You have heard that also a lot. And maybe when you were a child, you used to play with the mercury in the thermometers as well. Those things really exacerbate and have an impact on the disposal of things, on the pollution, but also are considered drivers. And all of those things, if you can sleep at night and you want to look at the report is called bracing for superbugs, and all of that is very well explained in there. Priority actions, you also asked that, Yasmin. So, of course, when we look at that, immediately some pillars come into our minds. One of those pillars is the governance, the planning, the legislation. That's key. If countries cannot really look into protecting their people through regulatory frameworks, legal frameworks, some things are or might not be in a way that they're right in the right direction. And when I am talking about this, some things are already things that many countries are doing. The issue is to bring maybe a little tip in their national action plans that can help them take interventions or make interventions that are appropriate. Second big pillar, knowledge and evidence. That's also key. We need to monitor, we need research, we need to understand better. Again, that should not stop us from action, but we have to, in a way, track what's happening. If we have, in a way, significant contributions to AMR from the environment pillar might not be sufficiently explained or clear, we already have evidence that they are resistant genes in the environment. And we know very well that when something is there that shouldn't be there, it will bring water, we have that in a way of looking at things as well. And awareness, this is the week, or this has been the week of awareness. That's essential. And when I was looking at the title of this dialogue, Intergenerational, I was thinking, well, when a baby is born, they put the drops, because of course the mother might be having an infection and then the child might be blind. Maybe it's the first moment in their lives that they are exposed to an antimicrobial. I don't know if that's still a practice, but I have 4 daughters and all of them were with the brownish thing in their eyes. So you are born, what's the first thing for you? An antibiotic or an antimicrobial. Maybe I'm just saying it, well, it's a bacteria, so it's an antimicrobial. After that, when we want to be grown-ups and we want to leave the diapers, we start with infections, with urinary infections that can last for very, very long time. And I can tell different moments in time where, depending on your age, you are more inclined to have certain diseases around the world. And what do? Knock, knock, doctor, please, I need an antibiotic. Please, you have to give it to me. Go to the pharmacies. In some places, you still can buy antibiotics with no prescription at all. That's awareness, but that's also prevention. If we really can manage things to do in a different way, and we prevent because we clean, because we wash our hands, because we just don't throw medicines into the bin, those little things can make a big, big, big change. So prevention does not only include us as consumers, it also includes the big manufacturers, the pharmaceuticals, the other chemicals manufacturers, because of what I was saying, there are other drivers in there. Agriculture and food, but I will not just get into that because our colleagues will talk about it much better than I will do. Healthcare facilities, that's another big, big challenge that we face. All of those things with poor sanitations, with sewage, with waste in the municipal systems, with our little dog or cat or hen that we have around us, all of those things we have to be very, very careful on how we deal with these things. Systems-based response is essential. One health approach, essential. But never forget prevention. That's really, really, really key, not only for the AMR situation, but for practically everything that we do. So for UNEP, youth, children are essential because they are not only amplifiers, they have a different way of running, of doing things, of social media. In few seconds, everybody knows where they are, what they are doing, how things are. So please, those that are here with us today and those that will listen afterwards, remember, it's fantastic if you are telling the right message. The Lancet last year, I think, or the year before, one of the global threats, the biggest global threats, do you know what it was? Artificial intelligence. I will never forget that because it brought into my thinking an area where we need to be very careful on the messages we pass, but we also need to use those tools correctly. So I will stop here because we have the next speaker, Miss Protoma Kalidaha, and I hope I am pronouncing your name correctly. A final year veterinary student at West Bengal University of Animal and Fishery Sciences in India, and currently serves as the chair of International Veterinary Students Association Standing Committee on Animal Welfare. Welcome. I have a question for you following the instructions we got from Yasmin. And the question is how you envision that emerging professionals like you are contributing to solutions at the intersection of animal welfare and antimicrobial resistance. And what are the challenges you understand are still needed in your region? Thank you.
First of all, I want to thank you so much for this wonderful question. So I want to start by telling a supposition. Like suppose I'm standing on a farm or in a community clinic as an emergency veterinary professional. So what can I really do at the intersection of animal welfare and antimicrobial resistance? So I often think about this because the link between the animal welfare and antimicrobial resistance is very real and it is very much important. Because if animals are stressed, overcrowded, hungry, or kept in dirty environments, they get sick more often. And when sickness becomes common, antibiotics are used frequently, sometimes even without proper diagnosis. So I see my contribution beginning with something very simple, improving the basic animal welfare. So as a young veterinary professional like me, I can help farmers and owners understand how clean housing, proper nutrition, enough space, enrichment, timely vaccination, and low stress handling can keep animals healthier. Because when welfare improves, disease automatically reduces and the need for antibiotic drops. So even as a student, I can demonstrate small changes like safe bedding, clean water, or better ventilation and show how this can make a big difference. I believe emerging professionals like me have a big role in awareness and communication as well, because many people in my region still thinks antibiotics are the fastest and the easiest solution for any illness. Some farmers buy antibiotics without prescriptions, use wrong doses, or mix medicines based on advice from non-trained sellers. So I try to talk to people in simple, practical language in my region so that I can explain that just like humans, animals should not take antibiotics unnecessarily, and misuse leads to resistance that affects the entire communities. So through student camps, vaccination drives, small talks, and even everyday conversations, I can help shift the mindset from curing to preventing. As we always know that prevention is better than cure. Research is another area where young professionals like me can contribute, like even undergraduate projects like checking antibiotic sensitivity, understanding hygiene practices, or studying common infections, which will help generate valuable data. So this evidence actually guides better decisions both at local and national levels. Participating in such projects can make us more confident and responsible in our own antibiotic use. But the reality is that important challenges still exist in our region. Access to veterinary services is limited, especially in rural areas. Many people rely on unqualified practitioners because they are cheaper or easily available as they think. Antibiotics can still be purchased without prescriptions, making misuse very common. There is also very low awareness about the withdrawal periods, which directly affects the food safety. Many farmers face financial pressure, so improving animal housing or nutrition feels expensive to them, and they choose antibiotics as a quick fix. And on top of that, collaboration between veterinary, medical, agricultural, and environmental sectors is still not strong, even though AMR needs a One Health approach. So, despite these challenges, I truly believe that emerging professionals like me can bring change by promoting good welfare, encouraging responsible and judicious antibiotic use, participation in research activities, and building trust with communities so that we can slowly reduce the misuse of antibiotics. Because every small action, every conversation, every welfare improvement, every awareness session adds up. Together, young professionals can help build a safer future where animals can be healthier, antibiotics remain effective, and both people and animals benefit from a stronger One Health solutions, because One Health is the ultimate and it is a interdisciplinary action and combining the threads of animal, humans, and environment. So thank you so much. That's all from my side. So moving on to the next speaker, I would like to introduce Dr. Jean-Pierre Namazi, who is the director of the Quadripedal Joint Secretariat on Antimicrobial Resistance and the head of the Governance and Strategic Initiatives units in the AMR department at WHO. Leading a dedicated team, he advances multisectorial action against AMR, focusing on implementation of the UNGA Political Declaration on AMR and other global commitments. So the question is, how inclusive are the implementation of GAP and IPEA processes in ensuring intergenerational and multisectorial representation? Thank you so much.
Thank you so much, Ms. Kardaha, for good question. And thank you so much for Catherine and the colleagues for inviting us. Yes, great question. I will start by saying that the inclusiveness and multisectoral collaboration for especially in the areas of updating the Global Action Plan and establishing the independent panel on evidence for action against AMR. That was clearly mentioned by the member states back in September 2024. So we have to do it. We have to make it happen. And these two processes are very critical. But even before we go the mandate, I'll go back in the preparation of the high-level meeting on AMR. Youth were critical stakeholders that we consulted. And I think the youth might remember about the Youth Manifesto and the key messages that you published asking the member states to consider. So that was really included in the discussion, even at the high-level meeting. And you remember the youth representative as well were present in the United General Assembly, and they made great appeal for the youth to be more involved. And we really think that the political declaration that came out from there was already youth informed. Now, in terms of the way we are implementing these key priorities, yes, youth are being consulted, and we do that as well by inviting the youth to provide their comments, to participate in the multi-stakeholder hearing and consultations, and also through the information session that we organize regularly at the Quadripartite Trend Secretariat. As you also mentioned, multi-sectoral is the way to go, and I think previous speakers mentioned that AMR is so complex, but as well it's also easy to address when you coordinate better among the sectors. And the sectors have been mentioned: animal human health, plant health, environment sectors, but as well when you coordinate among stakeholders, civil society, public, academia, private sector, and the others. So it's not only about really involving the youth, but it's also understanding that youth are coming from different sectors and they are coming as different stakeholders. Again, something as well we are making sure that is going to be very recognized in our plans is that youth are recognized not as beneficiaries, but as well as critical actors. And I'm glad to what you just said before me, that the youth, especially in the schools or in an early stage of your professional careers, you really hold the key elements in terms of AMR solutions. You know, one way you are the future or even current service providers in hospitals, you know, in farms, you're also there as future business developers or future business owners. So your own lands, your own farms, your own private investment in health and other places. So you're also part of the solution, and you're the ones actually who are going to help us to achieve the reduction of death due to antimicrobial resistance. I also know that youth has to be more involved, especially at the national level. We have multi-sectoral coordination mechanisms to implement the national action plans. And we know that for the fact that youth are not so well represented. So we will continue to advocate for the youth representation and the youth having the seats in the national multi-sectoral coordination, and also to have you as part of the decision-making process. So yes, you're involved, and the youth are very much welcome to continue to contribute to the updating of the Global Action Plan and the establishment of the independent panel. However, we need you most at the next stage, where the implementation of these two major changes will be required to be done. So wherever you are at the national level, at the global level, at the school, or wherever you are, I think you have a role to play, and we'll rely on you now and in the future to be able to address AMR. Thank you so much for the question again. And it's now my turn to introduce Mr. Simon Peter, who is a pharmacy student at the University of Papua New Guinea and currently serving as the national president at the Papua New Guinea Tertiary Student Christian Fellowship. Mr. Simon, the question is, what are the key AMR's challenges and awareness efforts in the Pacific Islands, and how are last mile actions and populations such as in Papua New Guinea being included in AMR solutions. Peter, over to you.
So Mr. Simon Peter seems to have some internet issues. So maybe we will just follow with Dr. Karina Kastik. So and move on. So Dr. Is she here?
Yes, she's
Okay.
here.
So Dr. Karina Kastik is a veterinarian based in Trinidad and Tobago, currently serving as a clinical teaching assistant in equine medicine and surgery at the University in Trinidad and member of the quadripartite working group on youth engagement for AMR. And my question is, how do you see engagement of youth in your region as a part of the current global AMR governance, and how representative is their participation across sectors, and what steps can be taken to improve inclusivity?
Hi, everyone. Thank you so much for the question. So, of course, youth engagement as a part of global AMR governance is of dire need to secure the future. And young people have been given platforms to voice their perspectives, but of course, still want to be more involved and help strengthen the fight against AMR. Youth representation today across sectors is growing, and young people are being recognized as leaders and champions in AMR. To improve the inclusivity of youth, however, we can definitely mobilize more youth-led campaigns in the region to aid in building a greater collaboration with youth in order for them to voice their opinions, their concerns, as well as their plans. We also would like to have more support for youth in AMR research. This is of dire need. We see that every day things are changing. More evidence is needed on the effects on the environment, on humans, on animals, on the climate as well, following abuse of any antimicrobials. Also, the inclusion of youth in the discussions and planning has been happening, of course, but definitely we would like youth to be more involved in the actions itself, in carrying out all these plans and the resources. Thank you. So I will now introduce to you Mr. Dominique Bergeon. He is the director at the Food and Agriculture Organization, liaison office with the United Nations in Geneva, with a career spanning over 3 decades at the organization in advisory and program leader roles. My question to you, Mr. Bergeon, how is the FAO addressing the link between food security and antimicrobial resistance through, and what can be done to enhance representative participation and collective action?
Well, thank you very much, Karina. It's great for us as FAO to be participating in this dialogue and to be contributing to the reflection on the issue. It's very good for us also to see that the quadripartite is well represented with all agencies participating, UNEP, ORA, and WHO, and of course FAO, and to see that you have this focus on youth. It's one of the conclusion of many of the work we are doing that shows that education, awareness, and even university curricula are so important in the context of AMR. But when it comes to FAO, I would say that, of course, food security and AMR are indeed deeply connected. And as a matter of fact, misuse of antimicrobials in agriculture and livestock production threatens not only human health, but also animal health and environmental health, and therefore the safety of all the entire supply chain. FAO therefore recognizes this challenge as a very important one and addresses it through a One Health approach. FAO's action plan on AMR focuses on reducing unnecessary antimicrobial use in crops, livestock, and aquaculture. And this basically means that we are promoting good farming practices, that we are working towards improving biosecurity and encouraging alternatives like vaccines and probiotics. FAO also works towards strengthening surveillance through systems like InFarm, which tracks antimicrobial use globally. And one of the FAO innovative initiatives is called RenoFarm, which stands for reducing the need for antimicrobials in farms. And this RenoFarm initiative promotes what we call the Farm 5 Gs, good health services, good production services, good alternative, good connections, and good incentives. This approach helps farmers improve animal health and therefore animal productivity without relying on antibiotics, making farms safer and more sustainable. At the global level, I hinted to that already, FAO works closely with WHO, OHA, and UNEP in the context of the quadripartite to align strategies and support countries in implementing national action plans. Additionally, FAO hosts the AMR multi-stakeholder partnership platform, bringing together government, private sector, civil society, and researchers to coordinate efforts. So now when it comes to the second part of your question, Karina, dealing with participation and why participation matters, I would say that addressing AMR is, of course, not something FAO can do alone. It is a global effort. And therefore we need representative participation and collective action. Farmers, veterinarians, food processors, policymakers, researchers, and communities all have a role to play in what needs at the end to be a whole of society efforts. Government must, of course, create the environment, the enabling environment, set clear targets and share data transparently. Smallholders need incentive and technical support to adopt better practices. The private sector can invest in alternative and stewardships program, and civil society can help raise awareness and change behaviors. And of course, youth should be involved at all stages. AMR, as was said before, is a silent threat to food security. But together, through inclusive platforms, shared responsibilities and initiatives like the one I mentioned, RenoFarm and also InFarm, we can protect human, animal, and environmental health. And I would say this is the essence of our work on One Health in agri-food systems. So now let me use this modality and turn to Dr. Noura Sheila, who is a physician scientist from Palestine, currently serving as vice chair of the WHO MO Youth Council and chair of the World Federation of Public Health Associations working group on public health in emergencies and disasters. And Noura, warm welcome. And I have what I feel is a very important question for you. And the question is about how antimicrobial resistance is being addressed in conflict and humanitarian settings, and what key actions have been or have to be taken.
Thank you so much for the question, Mr. Dominique. So, antimicrobial resistance in conflict and humanitarian settings is a daily reality, actually, in places facing prolonged crisis where I live, for example, in Palestine, specifically Gaza, Sudan, Yemen also. The conditions that accelerate AMR occur simultaneously, offering crowded shelters, damaged water and sanitation system, and shortages of essential antibiotics, of course, and disrupted diagnostic and surveillance capacities So, speaking as a young professional, actually, and leader from Palestine and the region, and working in emergency and public health response, several challenges are clear. First, the collapse of laboratory and diagnostic services leaves frontline clinicians, which many of them actually are young professionals, making treatment decisions that are very limited with very limited information. Secondly, also disrupted supply chains, which increase the circulation of substandard or unregulated antibiotics, which fuels resistance. And thirdly, mass displacement, overcrowding lead to rapid transmission of course of infections, including resistance organisms, especially when infection control resources are limited. And the fourth challenge is the complexity of AMR data in conflict settings. Data collection become fragmented across agencies, surveillance systems may collapse too, and laboratories can be unsafe to access or non-functional. Documentation also is often manual, inconsistent, incomplete due to insecurity or resources shortages. And this creates actually a major gap between the true burden of AMR on the ground and what appears in national or global reports. But despite these constraints, especially youth and young professionals, and speaking on behalf of the efforts being done, they have play a crucial and expanding role. As we said earlier, young people are in the part of the frontline workers applying innovative infection control practices, youth led networks, and what I have seen from my work with the Youth Council at the EMRO office at WHO, we see that youth led networks are really working on raising awareness on safe antibiotic use and mobilizing young researchers contributing which are contributing to community mapping and real-time documentation. And of course we have a huge base of youth volunteers who are bridging health facilities and communities through triage and last mile health education. So this is where intergenerational collaboration actually becomes essential. And senior leaders provide long-term strategy and policy experience, of course, but youth bring frontline realities, digital skills, adaptability, and close engagement with communities. Combined, these perspectives create solutions that are more grounded, practical, and sustainable. So, to strengthen AMR response in humanitarian settings, several priorities are need to be considered. First of all, integrate AMR into emergency and humanitarian health plans. We need to see this clearly. To ensure reliable access to quality assured antibiotics and basic diagnostics. Three, provide crisis adapted stewardship training to frontline clinicians, especially the young professionals. Four, improve data systems in emergencies with simplified reporting tools, protected civilian surveillance challenges. And five, invest in youth led and intergenerational community education. AMR in conflict settings shapes clinical decisions every day. And a meaningful global response requires crisis specific strategies, stronger data, and the fully engaged participation of young professionals and youth leaders on the ground. And from that, let me move to our next speaker, Miss Anne Eleanor Fonji. With a pleasure, I am introducing Miss Anne, who is a recent pharmacy graduate from the University of Douala in Cameroon and the chairperson of public health at the International Pharmaceutical Students Federation, IPSF. So, our question to you, Ms. Fonji, antimicrobial stewardship is a national priority, and pharmacists play a key role in safe prescribing and guideline implementation. As a recent graduate, how would you use your understanding of stewardship to work with pharmacists and other professionals to address antimicrobial resistance? Over to you.
All right, thanks very much for the floor, Duha. Greetings from Cameroon, and I will speak in my capacity as a pharmacist that is practicing in a hospital setting in a low and middle income country. Firstly, I believe that the first step of working with other healthcare professionals towards addressing AMR and adopting antimicrobial stewardship programs is by pairing education and with intervention. Why this? Education, because we can't practice and properly intervene in what we don't understand or in what we don't know detailedly about. That's a fact. I remember last week, my team and I at the hospital, we had a presentation on antimicrobial stewardship strategies that we could adopt, and the feedback we got showed that most of healthcare professionals were less informed on how their actions and their inactions could drive and cause AMR. So education is very, very vital, and it could be done by being regularly updated via frequent presentations, via reading latest research papers for new developments, and also, especially as antimicrobial stewardship requires a collective effort from all. So one of antimicrobial stewardship goals is also to ensure that the right drug is prescribed at the right dose via the right administration route for a suitable duration, while also ensuring a timely de-escalation to pathogen-directed therapy. So as a pharmacist, I work with my fellow pharmacist colleagues to ensure the timely review of antibiotic prescriptions, also focusing on proper dose optimizations, supporting clinicians as well with up-to-date guidelines on antimicrobial therapies, and more importantly, contributing during case reviews and watch rounds, and also intervening timely when necessary. At the end of the day, it's important we note that strengthening antimicrobial stewardship starts with building a culture where every health worker understands their role in protecting antibiotics, and stewardship actually requires a collective action, and I believe that young pharmacists like myself are also ready to be part of the solution. Thank you very much. So I now have the honor to introduce our next speaker, Mr. Javier Yugeros Marcos. Mr. Javier is the head of the Antimicrobial Resistance and Veterinary Products Department at the World Organization for Animal Health, possessing a strong R&D medical microbiology background with a proven track record in antimicrobial stewardship, biomarkers validation, product development, international partnership coordination, team leadership, and change management. So, Mr. Javier, I have this question for you. What actions are needed in animal health to sustain global momentum on antimicrobial resistance and ensure the sector is involved in all multi-sectorial discussion and in the engagement of all generations in the process? Mr. Javier, you have the floor.
Thank you very much, Eleanor, and thank you very much for inviting us to this dialogue. And it's a pleasure and an honor to be here. The ride under the rain, it was worth to be here with you. And analyzing your question, you're mentioning three action verbs. The first one is sustain the momentum within the animal health sector. And I would say that for the moment, things are okay. Overall, the veterinary services are facing worldwide something like 100 disease outbreaks on the last 6 months, which is taking them a lot of time. But every time that I call some of them, they do not just disconnect. They always want to talk to me and talk about AMR. Because there is one thing I think that they have already started to understand, which is that AMR is not just a topic, it's a consequence of weak animal health systems. And by strengthening these animal health systems, they can also cope and face the problems they have on a daily basis. So I think this is a very nice momentum that we are trying to promote with bilateral meetings with all the CVOs, the chief veterinary officers, participating to the regional conference that we have, launching awareness campaigns, etc. So I think the momentum is still up, and the results are there, because if you look at the different progress reports that have been made on the antimicrobial use in animals, you will see that the trend is going down in the animal health sector, even though we know that still much can be done, and that we are still somehow misusing antimicrobials in the animal health sector. Just to give you an example, in the last economic study, modeling study that we launched last year in 2024, we estimated that in average, those countries who are still allowing the use of antimicrobials as growth promoters are using 45% more antimicrobials than those countries who are not using or allowing this use. So I was very pleased when I was seeing the first slide on the survey. I think it was the results of a survey from the youth, where you were really hitting the nail in the head when you were saying the three things to do is awareness, is surveillance, let the data flow, and regulation. And I hope you can keep that in mind, because at some point you will be my age and you will be accountable for having those in place. So in terms of the animal health sector, I think the momentum is maintained, and so far we have even created a small leaflet for veterinary services to understand the complex UN language from the political declaration, providing specific actions on what they can do to achieve the challenging goals that we have there. Then how we can ensure that the sector is involved in sectorial discussions, I would say that this is one example. I mean, when they call us, they told us, you have to come. I said, well, now someone who has really understood that we only have one planet. And every time that I come to Geneva, I happen to always say this sentence, which is, I am the animal in the room. But in fact, I'm not. I'm not. We all are. And we have to remember that we are not more than one more animal species in this planet, and that we are sharing this planet with them, and that everything that happens in the animal space will eventually come to the human space and vice versa. And this is linking to the thing about how to engage with youth. I would say the first thing to engage with youth, and it's not only with youth, it's from the very beginning, it's education. And I think this is one of the, I would say, first things that have to be clear in every child in the world, is that we are not more than one more animal species in the world, and that all of us are interconnected, and that all of us are suffering from diseases, and that all of us need those antimicrobials for medical purposes, not for anything else, for medical purposes. Every time that any of you go to the supermarket, go to the restaurant, and just ask for food, just think about where this food is coming from, and where the animal that is giving, let's say, birth to this food was raised, the conditions in which this animal was raised, and we all have, let's say, a social responsibility on with everyday actions on how to engage every day the animal health sector in every discussion. I would say at the policy level, one thing that we have been advocating for, and we are still far from the ideal, is to create, once for all, for God's sake, multi-sectorial coordination mechanisms. If those are not created, we will not move forward. And I'm going to give you a very particular example of a country without the intention of pointing fingers. But this week it has been the World AMR Awareness Week. And France released both the antimicrobial consumption report in animals and the antimicrobial consumption report in humans. And guess what is happening? Is that in the animal sector, things are going down, while in the human sector, things are going up. Successes in one sector cannot warrant collective success. And once again, I'm not saying this to point fingers, because I think this is completely useless. I'm saying this because this country, who has a very nice cross-sectorial coordination mechanism, has to sit on the table and see what is happening and where should we put our money so that these things are going in the right direction and everyone is using antimicrobial responsibly. And then to the last point about youth engagement, I'm very pleased to be introduced by someone younger than me, and I'm very pleased to introduce someone much younger than me in the next question. But I would say it all starts with education at the very beginning, at the very, very basic level. And then when you are coming to this global forum, and you were saying that you feel pretty much involved in global forum, but not so much at the national level, etc. Fight for that and call us. Let us help you to introduce and to get into these cross-sectorial coordination mechanisms at national level, and especially not only just to invite you for nice speeches and public interventions, but to sit in the room where the things are happening, where the discussions are really happening, where those discussions, those tricky discussions about how to reconcile sustainability with infinite growth happen, because at some point you will be sitting in that table, and the sooner you start to understand which is the reality of the world, and that not everything is so, let's say, pink and colorful and Yes, wonderful, as you can imagine, and you have to start thinking and learning how to deal with those critical situations. So with that, I hope that I answered the questions, and really thank you for inviting us. And then now it's my pleasure to invite to the floor to Ms. Federica Castellana, Country Delegate and Project Manager for the Italian Red Cross in Djibouti, and Secretary of the Young World Federation of Public Health Associations. And the question that I've been asked to ask you is, how can equity and access be strengthened in the design and implementation of key actions to combat antimicrobial resistance, also known as AMR? Federica, the floor is yours.
Thank you. Thank you so much. And thank you also, Ever, for it felt like an inspirational speech, actually. So thank you. I will start from my experience with the young professional working group of the World Federation of Public Health Association. And I can say that equity and access in AMR response start with putting young professional at the center, of course, as we have been saying, I think a lot of speakers have been saying. And with our network, we actually have a committee that is just for AMR. So we have an AMR committee in the young professional working group. And then we bring together youth from across region, discipline. And so we have this actually multi-sectoral approach, and we have also the youth representation worldwide. And I think that these really help in understand the diverse needs, but also in the co-designing of solution that then bring to equity and then also to the feasibility of the solution, I would say. But I also want to give a concrete example of my work that I do in Djibouti with the Italian Red Cross. So the National Society, the Djibouti Red Crescent Society, is actually implementing a community-centered One Health project where local community are not just beneficiary, but actually active leader in disease surveillance. And so instead of just relying only on top-down data, community volunteers and also livestock owners, people and members of the community of the different villages are trained to understand the risk of antimicrobial misuse, but also they feed information that they are trained to collect back into local health authorities. And so this shift give actually the power to the community that then often have the earliest knowledge of health threats, and then this can help in strengthening both access to information and trust also in that system. And so when community participated directly, their surveillance become more accurate, prevention improved, and then also equity is naturally enhanced, and then the solution actually reflect the local reality. To go back then to the global level with the Young Professional Working Group of the World Federation of Public Health Association, we work on awareness, we work on research, we work on advocacy, we collaborate with international organization and EU network, this is also one of the reasons why we are here today. And we also emphasize and we advocate also within our leadership to bring youth into the strategic decision where the strategic decision actually take place, as actually Javier was saying before. And the recent example is the decision that we took for the submission of being part of the new WHO AMR task force. And actually in this task force, the World Federation of Public Health Association will be represented by one of the co-lead of our Young Professional Working Group, so by the AMR committee of the Young Professional Working Group. And so this means that a youth voice will be will be speaking on behalf of all the World Federation of Public Health Association, and so showing exactly the kind of meaningful youth participation that we actually need. And so, yes, I can say that to strengthening equity and access in MR, we need community empowerment on the ground and then youth leadership in the global governance. And so when both are present, AMR strategy can become more inclusive, more representative, and then also more effective. So I will end here. I thank you also for the invite, and I will now introduce Yasmin Bayruk. Yasmin is an intern at the Health Diplomacy Alliance from the University of Geneva. She's graduating at the end of this year, so congratulations, from her Master in International Relations. Our focus is in the intersection of health diplomacy and environmental issue. Jasmine has been following recent process also of negotiations such as plastic treaty, COP, and AMR independent panel. So Jasmine, the question for you is, what is the role of health diplomacy in shaping and governing a collaborative, One Health-driven response to antimicrobial resistance, AMR, especially when there are other health and political priorities? The floor is yours, and thank you.
Thank you, Federica, and thank you for introducing me and for the question. So I will give a few highlights points on that. So when we talk about health diplomacy in the context of AMR, a central role is ensuring that global and regional actions can be translated into effective policies and adapted to each national context. It is also important that all actors are able to monitor progress and uphold a minimum level of accountability. Only then we can understand the real impact of major political commitments, whether they come from political declaration or from specific political groups. This is exactly why the Health Diplomacy Alliance is launching next year an initiative called Click the Box, designed to support this work and help elevate the efforts that governments and the quadripartite, might need to advance these commitments. Diplomacy is needed not only to monitor, but also to strengthen the budgeting and the financing mechanisms required for the implementation of the global and the national action plans on AMR. And this includes mobilizing non-traditional sectors, but also securing investment for innovation, diagnostics, and science. And finally, diplomacy plays a role in how we communicate globally about AMR to ensure that the message translates into accessible and digestible language for all. So that being said, I will stop there, and I would like to thank everyone for the rich discussion and the valuable contributions. So now I will give just the floor to Catherine Ubaez to moderate the rest of the discussion. Thank you.
Thank you very much, Jasmine, and thank you all for that interesting dialogue. I took some notes about some of the key aspects from triple planetary crisis, misuse of AMR, heavy metals, global action plan, health communities, political engagement, food security, biosecurity, livestock production, conflict setting, data collection. I am quite surprised to hear about, to be honest, about the trend of going down in terms of AMR in animal. Yeah, AMR. Yeah.
We can talk about it.
Yeah, with pleasure. And how youth comes into all this part of the equation in terms of AMR. So that is something that leaves us a lot of discussion ahead of us, and that shows us that there is a lot of work we have to do across sectors. So now we pass to the Q&A. If any online, I know that there are some questions that have been popping up online and in person. I will take also the opportunity, as Simeon had some technical issues before. Simeon, if I can, I will address once again, if you are there, the question that it was posed by Jean-Pierre Nemasi. Are you there? Yes. So the question was, I repeat it because I think GPA is not there. What are the key AMR challenges and awareness efforts in the Pacific Islands? And how are the last mile actions in populations such as Papua New Guinea being included in AMR solution?
So I'll read the question again.
Yes. So
Can you put the question?
Yes, the question is to know about the challenges and the awareness efforts that the Pacific Islands are having in terms of AMR, and also how our last mile actions and populations, such as your population in Papua New Guinea, are being included in AMR discussions and solutions.
All right. I believe one of the challenges, especially in terms of the AMR in Pacific Island, as well as because Pacific Islands, most of the countries are under resourced in terms of fighting against AMR challenges. And one of them could be limited resources and capacity for surveillance and monitoring. That is to do with, especially in the laboratory in the hospital side of it. And there is a need for the increased investment in laboratory capacity and some of the antimicrobial stimuli program. So one of the initiative that is undertaken is by the Bonnet Institute, which are through the Fleming Fund Country Grant, which is supported by the Australian government, and they do uh, emphasize on the building the capacity in the hospitals and laboratory for collecting data to research, so that the proper surveillance on the data of the AMR can be collected, and ways to develop programs that are related to fighting against the AMR, especially in stewardship programs. And one of the challenges is the human resource support. And I believe the government is taking crucial steps forward, initiating plans based on the WHO recommendations to fight against the AMR. That is one of the major health challenges in Papua New Guinea. And of course, one of the major challenges would be in terms of the regulations, because some of the drugs that are being imported into the country in most of the Pacific Island nations are substandard, and there is a need and the emphasis needs to be made on the regulations aspect of the pharmaceutical supply chains in the Pacific region, so that the substandard drugs could be limited and regulated so it does not enter the countries. Because when it enters the country, one of the challenges that we face in most of our communities and in our country is that most of the medicines are being sold on offline, which is not being sold in the pharmacy stores like being really regulated, but especially the over-the-counter medications. So that is one of the challenges that is affecting the country health society right now. Most of the medicines like amoxicillin and others are being sold on the streets. So we really need the regulation system to be strengthened so that major the medicine will not be sold on the street, so that control can be applied to how we manage and look after the people. Yes, that is one of the challenge. So basically, in terms of regulation, that is a challenge. In terms of the human capacity, in terms of the capacity in the hospital, those are the challenges. So more solutions need to be made there. Move
Yeah.
forward with some of the initiatives that have already been put forward by the government.
Thank you.
Yes.
Thank you very much, Simeon, for your inputs. We have roughly 3 minutes. I apologize, I'm rushing, but this has been a really interesting conversation. Does anybody want to take the floor? I'm putting a lot of pressure now, those ones who are here, to make a statement in three minutes. If not the case, I think this conversation is gonna continue. I don't have the permission to say that, but I will be bold and say it. I will count with once again, so like Diana, she mentioned, last year we had from Jeddah to Geneva. This year we had the intergenerational dialogue, so I think we should do something like, it's a tradition to hold this kind of dialogue here in Geneva with the quadripartite. So let's start thinking about how will be next year and what we do in between in terms of the work on antimicrobial resistance. And I think Diana, she's happy that I said it, right? So, but thank you very much, all of you, those online and those in person, despite of the rain. And I look forward to collaborating with all of you in terms of the works that are coming ahead of us. And then I pass the floor to Diana to brief the announcement. Thank you, Diana.
Announcements, and also a great thank you for all the young people in the room and online, and also the less young people, friends, colleagues who have joined us as panelists or as attendees for this event. I just want to make some publicity for some upcoming events. Tomorrow we'll host a briefing at the International Environment House here in Geneva in preparation of the upcoming United Nations Environment Assembly. And actually, there's a resolution on AMR being discussed as we speak. Colleagues will also reflect on that resolution. It's a resolution that's proposed by Kenya and other states. So we look forward also to welcome you if you're interested in the United Nations General Assembly or joining UNEA next month to join us tomorrow online or in person. And then we have a few other upcoming events that you can see here on the screen. One that can be of interest for this community is part of a series of events that we run on pharmaceuticals and pollution-related issues. And we have the next webinar in that series coming up next week. So we look forward also to see you on those occasions. And then a few other things coming up, including in February in Geneva, we'll host the first plenary of the new Intergenerational Science Panel on Chemicals, Waste and Pollution. And there are a few events in preparation of that important session. So for those who don't know what it is, this is the equivalent of an IPCC, but for the pollution area. We have a session coming up later this month, but there will be other events in preparation of that Geneva plenary taking place the first week of February. And then another important event for us is a science policy day that we are hosting at the International Environment House on the 17th of December, for which you are all invited to join us in person. The event will be streamed, but we encourage all those based in Geneva to join us. And we have also invited FAO and all the members actually of the Quadripartite. Maybe not ROA because you don't have an office in Geneva. Join us and showcase of all the work that you do in that area. So with that, I think we can close the event, and I think we can also clap. So goodbye to all.